Fed up MTA workers on the picket lines. Good evening. I'm Michelle Ruiz. Holly Williams is on assignment tonight.
Good, I'm Paul Moyer. First we had the supermarket strike. Now we're dealing tonight with an MTA strike. And in a sprawling city like this one, built around the roads and the freeways, the impact of this latest strike is severe. Hundreds of thousands of passengers, many of whom can afford it the least, have now been stranded. We got live team coverage tonight. Let's begin with Gordon Tokumatsu live in downtown Los Angeles. Gordon.
Well, Paul, the transit strike really boils down to a question of who should manage the health benefits fund of the MTA mechanics, but don't tell that to the nearly 500,000 rail passengers and bus passengers who found themselves without service this morning. They had other things to think about. If you didn't think the MTA strike would affect you because you don't ride the bus or subway, take a look at this. The gridlock of overcrowded freeways. Many more cars this morning to make up for those lost passenger seats. At bus yards, picketers yelled for public support. Union mechanics like Art Aguilar, whose wife recently had a premature baby. He says the strike is about losing his health benefits.
Without my medical, I would have had to pay thousands of dollars out of my pocket. So that's the reason why I'm out here fighting for this.
Aguilar says with his salary, he would have plunged into debt. And that's true, he says, of his fellow mechanics as well.
Once you give them a foot, they want the whole leg. We don't want to give that up.
But managers believe the mechanics have had too much for too long. And in these dire economic times, they want to increase workers' out-of-pocket health costs substantially.
The MTA fully subsidizes the health insurance for each one of their employees. NBC doesn't do that. The County of Los Angeles doesn't do that. Nobody else in America does that.
For now, neither side is budging, and it appears the bus stops will remain empty for many days to come. MTA managers say they want to have control of that health fund, and that would probably mean more out-of-pocket expenses for the workers. The union says no way, and that's what you call an impasse. Reporting live from MTA headquarters, Gordon Tokumatsu, Channel 4 News.